Talking about the aneurysms or the dilatation of the cardiac vasculature, usually it's basically a birth malformation, and that can also contribute towards a disease state or towards a state of cardiac insufficiency. So it's again going to be quite a fatal condition that is going to be observed in a lot of cases. Then we can have some by birth defects that are basically the aortic valve diseases that are going to constitute over here. So talking about these diseases, basically we are talking about the aortic valve diseases and the aneurysms at the same level, and they'll be discussed over here in this section. We'll be discussing the sudden death due to the aortic valve diseases, the sudden death due to the rupture of the aneurysms. It's also discussed over here. And moreover, the atherosclerotic conditions that are going to result in the dissection or the syphilitic aneurysms, they are again going to be discussed, and it's basically an infectious state. Syphilis is basically the sexually transmitted diseases that can affect the heart as well. So all of these myopathies and all of these disease states are basically discussed over here in this section. So moving on, we are going to discuss the sudden death in the aortic valve diseases. So as you can see, basically we have the between the right atrium and the ventricle, we have the tricuspid valve, and between the left atrium and the left ventricle, we have the bicuspid valve. So these valves can be affected at this level, and we are going to basically discuss why are these valves affected and what are the genetic defects at this level that can cause damage to the heart muscle. The stenosis leads to the sudden death, and that is basically going to be found in an idiopathic calcific aortic stenosis. The aortic stenosis of the rheumatic disease, it's again going to be looked for, and we can have a myocardial lesions that are looked for at this level. Then we can have the valves that are thickened and they're quite rigid at this level. Moreover, we can have the tight aortic valves. So these are the different variations that can occur at the valvular level. There can be the tightening of the valves. Along with it, it can be an infectious state, or it can be an idiopathic calcific aortic stenosis. So all of these conditions are quite diseased in this state. The left ventricular enlargement is noted down at this level, and we have to look for it. And then we can have the hypertension that prevents the flow in the intramural arteries as well, which is quite less common. There can be a distortion of the coronary ostia as well noted down. And we can have the concomitant coronary atherosclerosis, which is noted down at this level, and that can cause basically sudden death in a lot of individuals. So the enlargement along with the hypertension, all of these conditions can basically raise a question on the intramural arteries, and they can cause the insufficiency or the compromisation of these arteries at this level. So the rupture of the aneurysms, it can result from the hypertension as well as it can result from a traumatic state. All of these can be the risk factors for the aneurysms. Again, we have the types of the aneurysms that are seen at this level. We can have the atherosclerotic aneurysms, as you can see even in the diagram. It's basically the arch of aorta is an aneurysmal state. So if this aneurysmal vasculature is broken down after a trauma or after a hypertensive episode, it can lead to damaging of the heart muscle. And then we can have a dissecting aneurysms even noted down at this level. We'll have the syphilitic aneurysms noted down. Syphilis is basically an infectious condition, and we can have the ruptured cerebral aneurysms also noted down at this level. Talking about the atherosclerotic aneurysms, they are very common and they are seen in the abdominal segments of the aorta most prominently. They are worse below the diaphragm. If they're above the diaphragm, it's not quite a fatal condition. And if they're below the diaphragm, it's basically quite of a fatal condition at this level. The turbulence and the Venturi effects, they're also noted down. For example, it can be a traumatic condition, or the trauma or the extensive acceleration or decelerative injuries can be quite traumatic for such a heart or such an aneurysmal condition. They can be localized on the development of the fatty streaks and the plaques. There are a lot of different types of the aneurysms, ranging from the fusiform aneurysms to the saccular aneurysms. The atheromatous aneurysms are basically the fibrolipid degenerative processes of the atherosclerosis. So it's basically the formation of the fibrin along with the lipid content that is going to compromise the vasculature. The bulging is basically caused due to this thrombotic phenomena that is occurring inside the aneurysmal state. Basically, what happens is the underlying pathology is discussed over here. It's basically the platelet and the fibrin deposition that is followed by the lines of Zahn, and the blood is leaked into the retroperitoneal tissues, and there is a gross calcification followed after this whole phenomena or this whole event has taken place. We have the degeneration of the aortic valves noted down, and the dissecting aneurysm will basically give you a condition in which rupture can take place, which is quite less common, which is followed by the second most frequent cause of hemopericardium, which is followed by the cardiac tamponade. And then we'll have the span of the whole length of the vessel affected after this. After that, we'll have the medianecrosis phenomena, which is followed by the thick elastic media degeneration. So it's again one of the emergency states that can occur after such a dissecting aneurysm that has taken place. We'll have the dissecting hemorrhage that often bursts at this level, and the double-barreled aorta will be seen. After the rupture of the aortic aneurysm, we'll see a double-barreled or a double lumen aorta. That is the evidence that has to be looked for. The coronary ostia is again featured upon or focused upon, and all of the signs of the thrombosis are noted down. The Erdem's mucoid medial degeneration. It's basically the degeneration of the intimal wall, and it has to be commented upon at this level as well. Marfan syndrome is a genetic disorder in which the vasculature is affected, so we have to look for the signs of the Marfan syndrome as well. The vascular disorders, and at this level we'll basically focus on the aortic dissection as well. We have the syphilitic aneurysm, and it's quite uncommon because it's basically a sexually transmitted disease which is undiagnosed in a lot of cases. And the syphilitic aneurysm of the aorta is always in the thoracic segment. It usually is in the arch of the aorta. The syphilitic aortitis is basically commented upon whether it is found or not, and then we'll basically focus on the atheromatous plaques. If they're found, and along with the other changes of the syphilitic aneurysm, then we'll comment upon it accordingly. The other features at this level are the sinus linear folds, like the coarse wrinkles, internal blood pressure blowout, and syphilitic bulge is looked for, erosion of the bronchi, esophagus, and lungs, including the external bursting of the pulsating chest tumors, along with the hematemesis or the hemoptysis. So the Gough's test is basically performed for the conclusion of the syphilitic aneurysm at this level. The fatal aneurysms are rare apart from the cerebral arteries, atheromatous bulges, polyarteritis nodosa, erosion of the walls, the infective mycotic aneurysms, and the pulmonary arteriovenous malformations, along with the massive hemothorax in hereditary hemorrhagic telangiectasias. They are looked for and they are commented upon in the autopsy report. So in this section, basically, we dealt with the aortic valve disease and how it can complicate the situation. That is the end of this section. Thank you for watching scardio.com.